Hi, I'm IHansen. My research topic was centered around the medical profession. In my donor school project, I explored the relationship between doctors and other medical staff to their patients. The question I chose to research was, does a good doctor-patient relationship affect the overall health and outcome of a patient? Most people would think that the answer should be obvious, yet it's more complex than they think. It's estimated that in a doctor's career, he or she will conduct as many as 150,000 patient interviews. However, sadly, communication training for doctors and other healthcare professionals is historically lacking. Extensive studies show that no matter how smart a doctor is, if he or she can't communicate well with the patient, that doctor may be of little help. Poor communication can cause serious problems. Studies show that poor communication can result in inappropriate treatment plans, poor discharge instructions, and low patient satisfaction. According to a study in 2007 by the Joint Commission's Office, poor communication was the most common factor in malpractice insurance claims. Now picture this. Imagine someone with a common medical disorder, say diabetes or hypertension, for example, and they see their family physician regularly. They develop a more serious condition that puts them in the hospital. And while at the hospital, they're most likely not going to be able to see their usual family physician. So this patient now has a completely new set of doctors who they've never met, who most likely don't know anything about this patient besides the fact that they're sick. Now add to that, this patient has 3 shifts of different hospital staff every single day, which is a norm in any hospital setting. It's no wonder that in a recent national survey, it was found that 56% of randomly selected hospital patients cited communication problems with their hospital staff. Most of their complaints centered around not being able to understand or not being told what to expect while in the hospital. Almost all the patients felt like they had little opportunity to speak to the hospital staff about their medical problems. In another study, 70% of medical errors in the hospital were caused by poor communication. Now, this is just while a patient is in the hospital. Good communication is critical when a patient is leaving the hospital as well. Due to healthcare costs, patients are leaving the hospital quicker and sicker. When discharged, a patient is very vulnerable to injury and medication problems. It's very important that the hospital pass information on to the patient, the patient's family, the patient's family physician, and even their pharmacist. And this is especially true if there are any changes in the patient's medication. So this is why with my internship, I decided to work in a hospital setting where I got to work with patients that were about to be discharged. So for my internship, I worked with 2 mentors at the Culpeper Regional Hospital. My first mentor was Kimberly Stewart, who worked with educational development. Together, we were able to talk about my research question and my topic, and she was able to set me up with my full-time mentor, Jane Kemp, who is a social worker there at the hospital who's been working for almost 20 years. On my first day there, we jumped right into the action after I had to sign numerous confidentiality papers. Every morning when I got there, Jane and the other social workers would gather together and would talk about any updates that happened to their patients over the night. They would give each other tips and information about things patients complained about, commented, or simply mentioned, such as if a patient was unhappy with the temperature of the room, so the others could ask their patients how they were feeling about their room. One instance of a good communication error that happened while I was shadowing was when a doctor had signed off on a patient's papers to send into a nursing home. It was the completely wrong nursing home. So once the patient was sent back to the hospital from the wrong nursing home, Jane and I resolved the issue and he was sent to the right one. But it was just a perfect example of what happens when communication fails. And so After the early morning sessions with the other social workers, Jane and I would make it up to the floor she was stationed on, which was the step-down unit, which is a unit where patients go right after surgery or right before they're to be discharged. In between patient checkups, we were never still. We would be getting pamphlets, papers, and other sheets of paper for patients that asked for them right before they were discharged. And patients would ask for anything ranging in between at-home physical therapists to bedside medical equipment. So it was all over the place. But, one of my favorite things that happened while I was shadowing was when we actually got to help patients that we weren't assigned to that day. Jane would answer any questions that any random visitors or patients asked, and she would answer all of them completely, no matter how busy her schedule was. It was just really nice seeing how much Jane cared about everyone there at the hospital. During my shadowing, I got to see behind the curtains of the hospital and see just how much it helped with my research topic. I was able to watch and see the interactions between nurses and patients, and just how much a good relationship and good communication helps with the patient's initial outcome. My community service, for my community service, I decided to create an educational program for doctors' offices and the like all across Madison and Culpeper County. I chose to do medical advanced directives because the main purpose of this document is to help communication between a person and their healthcare provider. So with the help of my advisor, Jane Kemp again, I am designing a series of posters, pamphlets, and brochures to help inform people about medical advanced directives. In a nutshell, an advanced directive is a form that lets someone's wishes be known to healthcare professionals and their family in the event that they can't express their wishes on their own. For example, my grandmother almost 20 years ago filled out an advanced directive stating that if she was ever in a situation where she couldn't eat, speak, or breathe on her own, she wouldn't want to be put on life support. And her wishes were honored years later when she suffered a massive stroke. So, people these days hear plenty of misconceptions and rumors about advanced directives and say how they're binding or unchanging, for example. My educational program is going to be designed to let people know that these rumors are nowhere near the truth. And so they'll also help explain how to fill one out, why you should get one, and how to fill one out, how you can get one, and why you should fill one out. They'll go I plan to make them go step by step to explain how to do one and how easy it is to do one and why you should do one while you still have the opportunity to do so. Through this project, I learned two major personally significant things. But first of all, through this project, I realized that I'm making the right career choice in going into treatment. I'm happiest when I'm helping people, something I already knew but didn't really know how to express. Through this project, I realized that in becoming a doctor, I'm really just learning how to express myself. And secondly, I learned that there are so many other people out there like me who want to help people. I've never really been in a hospital setting before, but through this project, I was able to see in the hospital how well people work together. The staff I worked with for my internship exposed me to a family-like setting that I wasn't really expecting in that type of environment. I was really able to grasp the concept of different people with different skills working together for a common goal, something I hadn't really been exposed to before. It was really nice, it was really refreshing, and really excites me for my future career. Any advice I would give to upcoming seniors, my biggest thing would probably be, when you start off, have multiple internship opportunities at once. So if one fails, you have something to fall back on, and you're not just left flailing.
Did you ever work with a specific doctor, like your own doctor?
Not specifically a doctor. I was pretty much just stationed with the social workers, pretty much just Jane. I got to see some doctors when we were at the step-down unit, but I never got to work with them directly.
The work that you, excuse me, the work that you did with Heidi Lord here as a mentor, what kinds of things did she give to you that you felt would be advantageous to work in a school setting and bringing this kind of information and communication to the school setting?
Well, could you repeat the first part of the question, please?
When you worked with Heidi, did you work with Heidi?
No.
Oh, you didn't work with Heidi?
No.
Okay. That was you. Sorry.
So what's your answer?
Sorry.
No, it's fine.
And you haven't distributed the help with the advanced medical directives yet?
I haven't distributed that to the doctor's offices yet. I'm still working with Jane to create posters and the brochures just to make sure that everything's correct. Actually, if anyone's curious, I brought Virginia approved advanced directives if anyone look at them. Because the forms themselves are actually very, very simple. It's very just follow the directions and then you're done. And if you want to, at any point, you can change them. People just don't seem to realize that. I mean, you're plenty of rumors that once you write it down or once you fill out the form, you can't change it at all. So that's what Jan and I are planning to do, is help people realize that it's not about anything.
Where will you put the posters?
We haven't gotten these specific places yet, but Jane and I are working. Later, we hope to start contacting any local doctor's offices, clinics, places like that. Anywhere where just people can glance over at a wall and they'll see the poster and they'll see the information on it.
And where are you going to school next?
Oh, I'm going to VCU to study treatment.
Okay. Thank you.